Starting with the name of Allah, the most gracious and the most merciful. My name is Dr. Bilal and I'm Assistant Professor in Forensic Medicine Department. Today we are going to discuss the last and final portion for our general toxicology. I should mention that we already done the general definition in General Toxicology 1. Then we go for the general diagnosis and treatment in General Toxicology 2. In 3, we discuss different routes, administration, and fate of the poison. In General Toxicology 4, we discuss specifically the gastric lavage. And now this is the final portion for the general toxicology. Fifth one, we are going to discuss what are antidotes. It's a very important topic. It can come in pharma as well as in forensic medicine, uh, auspice. One should know about that. What is antidotes? How they works. This is our today's topic, antidotes. So let's start with what are the antidotes. Antidotes are actually those therapeutic substances. First thing, they must be used for therapeutic purpose. All right, they are the therapeutic substances which counteract the effect of the toxic things. For example, if we have some toxic poison and they are producing signs and symptoms inside the body, and if we introduce something else to this poison and that decreases the effect of the toxicity, we can call that antidote. So what is antidote? This therapeutic substance that counteract the toxic action of any xenobiotic. So what is xenobiotic? Anything that's come outside from the body and foreign body for the organism is called xenobiotic. All right. So xenobiotic might be useful and might be dangerous. Let's start something from our lecture 3, how we're going to treat the acute case of the poisoning. So we discussed the removal of the unabsorbed poison. How are we going to remove the unabsorbed poison? By doing the gastric lavage and by emitting vomit. Gastric lavage plus emesis. These were some process by which we remove the unabsorbed poison. And after that, we use of the antidote. Now, this is our today's topic. And actually, this is the second step of general treatment of acute poisoning. Elimination of absorbed poison by using the different process of dialysis, and then general treatment and sign and symptoms and maintenance of patient general condition. So let's discuss the antidotes. We know about the definition of the antidotes. These are those substances which are given therapeutically to counteract the action of any poison. It's called antidote. According to the site of action where these antidotes are going to work, they are classified into different categories. Let's discuss the classification first. Physical antidote, chemical antidote, chelating agents, serological antidotes. These are four different and physiological antidotes. These are five different type of antidotes and they're gonna work on a different sites in the body. For example, 1 and 2 are the antidotes, like physical and chemical antidotes. They are working inside the stomach when the poison is unabsorbed. For the 3 and 4, the poisons are present inside the bloodstream and now it is absorbed. So the chelating agent and serological poisons are acting when the poison is absorbed inside the body. And however, 7 is the target cell and they are showing the signs and symptoms on the target cell. So for that, we need a very specific type of antidote. We call that physiological or pharmacological antidote. We'll be discussing that later on. So according to their counteract actions and site of actions, it might be working on GIT, it might be working on the bloodstream, and it might be working on the target cells. All right, these three areas where we are expecting our poison to be present. So if it's working on the GIT, we need something that is in unabsorbed condition and highly effective. It's going inside the blood, might show some sign and symptoms, and the sign and symptoms are very exaggerated. Then it's mean it's working on the target cells as well. This is a 5 classification for the antidotes. We call that mechanical antidotes, chemical antidotes, chelating agents, serological antidotes, and physiological and pharmacological antidotes. These are different type of the antidotes and very important for the exams. We'll be discussing each one of them separately. Again, according to the site of action, chemical and physical antidotes are going to work when the poison is unabsorbed inside the stomach. 3 and 4, which are the chelating and serological antidote, only work when its poison is inside the blood, and physiological antidote gonna work when it is acting on the target cell. Mechanical antidotes are actually these antidotes which produce a mechanical barrier between the stomach and the bloodstreams. All right. So any mechanical barrier that is produced inside that is stop the absorption of the poison to the bloodstream, we're going to call that mechanical antidote. They are further classified as adsorbents. Adsorbents like sponge, they have the ability to sponge everything inside themselves. And then a top example is charcoal. What is charcoal? How charcoal is produced? We're going to discuss that as well today. So absorbent are those antidotes. If I specifically say absorbent are those mechanical or physical antidotes which have high property to absorb poison on their surfaces. And the highest example is the activated charcoal. After that, we are going for the demulcents. Demulcents are those uh, poisons which again creating a layer on all the intestinal layers, and these layers will create a barrier which will further stop the absorption of the poison. So these are the demulcents. Highest example for the demulcents are in the stomach are milk, ghee, oil, butter. So what gonna absorbent do? They're gonna absorb like a sponge. What gonna demulcents do? Demulcents produce a layer around the stomach, stop the absorption of the poisons, produce a protective layer. And diluents are those poisons which can decrease the effect of the poison. For example, the plain water or might be the milk, bulky foods. What can they do? They can dilute its effects. So overall mechanical effects, mechanical antidotes are three: adsorbents, demulcents, and diluents. Absorbents are the one which absorb all of the poisons. Demulcents are the one which create a barrier, and dilutes are the one which dilute its effectiveness. Now, as we know, charcoal is a physical or mechanical antidote. So it is in a black color and it's odorless, fine powders. It might be get from the animal source and might be get from the vegetable sources. All right. An animal source can be obtained by burning the bones, especially the long bones. And vegetable can be prepared from the wood, coconut shells, or maybe in the case of bread and case of higher emergencies. So this is the charcoal. This is the life-saving antidote in the normal routine used in the ER. Activated charcoal, how this charcoal got activated, we'll be discussing that. So there are different types of the charcoal. One is the simple charcoal that has been produced by burning the bread, but if the intensity of the heat is got so much high, so it becomes in the activated form. Now this is the activated charcoal which has been burned around 700 to 800 degrees centigrade, and if we increase the temperature up till the 1000 degrees centigrade, then there will be this super activated charcoal. So what are we discussing here? We are discussing that higher the temperature, higher its absorbent properties of the poisons. All right, so super activated is the one who has been burned around 1000 degrees centigrade. It is used for absorb a large number of poisons. We use the activated charcoal in almost every gastric lavage, and it should be done within the 30 minutes before the absorption starting. What are the advantages of using charcoal? Easily available, can easily be extracted out of the body, and most interesting thing, it has not affect any metabolism inside the body. जैसे था जितना poison है उसको अपने अंदर absorb किया, absorb all the poison inside itself and then excrete through the body very fast and easily. And what are the limitations? We cannot use it for the cyanide, and it has very little ability to absorb alcohol, plus iron and other heavy metals, they cannot absorb it. So most of the time, most poisons contain the iron as in a mixture. So here we cannot use activated charcoals or charcoals. Now again revise, we start with the physical antidote. What are the physical antidotes? The one that might be absorbed inside the stomach, have absorbent properties. It might be the uh, uh, mm, uh, emulsions which produce a protective layer, and it might be the diluents that dilute the effects. Next one is the chemical antidote. So chemical antidote are the one that affect chemically inside the body, produce the chemical reaction and decrease the toxic effect. On top example are the acid. If we have some acid as an poison, so we're gonna neutralize its effect by giving the weak solution of the bases like cane fruits, lemon juice, vinegars, as well as we are can give albumin for the mercury chloride poisons, which will create insoluble mercury albunate, plus for the copper, which will produce copper albunate. Similarly, if the poison is the alkalis that neutralize the acids, so can be given, for example, alkalines which will be given in the cases when the poison is acid. Hydroxide, for example, magnesium hydroxide, calcium hydroxide should be given, as well as in the common salt should be given in the case of the silver nitrate poisoning produce insoluble silver chloride, and copper sulfate should be given in the case of phosphorus poisoning produce the copric sulfide. So what is the discussion of this topic? So chemical antidotes are those antidotes which will chemically react with the poison, produce either insoluble or less toxic substance, and their chemical reaction is very important to produce something new from the old one. Again, they gonna work when the poison is unabsorbed. Now the third one is the chelating agent. Do you remember chelating agents are something that has the clause and is highly favorable in the metal ions. So it's something that has a very high clause, and whenever it sees the metal, heavy metals, it gonna capture that inside themselves with a clause. So these are the chelating agents. They are actually the metal lovers, and they convert them into inactivated other metals which can easily be extracted throughout the body. The top chelating examples with us are the BAL, British antilevicides, calcium diethyl tetraacetate, ethylene diamine tetraacetate, and penicillamine. These are top example for the chelating agents, and they are gonna work on the heavy metals. They have clawing capturing properties. Do you remember BAL was first introduced in the World War for a very specific poison that has been used in the World War, that is leviside gas. It's a war gas. Inshallah, we will be discussing that as an effects. What are the leviside? Leviside. We'll be discussing that what is the leviside gas and how British anti-leviside gas has been introduced for that specific type of poisons that has been used inside the missiles and bombs. So Ball, I told you about that it has been discovered in the World War for a very specific type of gas, and against that it's very effective against arsenic and mercury. Doses are 3 milligram per kg of the body weight, but there are some side effects as well, like anorexia, restlessness, body ache, nausea, vomiting, convulsion, coma, and death. We go for the EDTA that's highly specifically used for the arsenic, lead, and mercury poisoning, and their side effects are hypotension, neurotoxicity, and hypokalemia. Penicillamine, the therapeutic dose are used for the mercury, lead, and copper poisoning, and their side effects are allergic, anaphylactic shock, nausea, vomiting, fever, aplastic anemia, optic neuritis, and nephrotic syndromes. Again, we discussed some poisons that has been dealt inside the stomach when they were unabsorbed. We come them under category of the physical and chemical antidote. And then there were some poisons that is present inside the bloodstream, and specifically the big iron metals. So they are get by clawing agents, chelating agents. Now we are going to discuss something that also gonna act when the poison is observed, that is the serological antidote. Do remember, serological antidotes are those antidotes that which are produced by the antibody antigen reaction. For example, if there is a snake and we need some snake venom, anti-snake venom, so anti-snake venom can only be produced by if the snake has been bitten by a horse, and the antibodies are produced inside this horse, and this antibodies are further given back to the people that has been mm, caught by this same snake venom. So serological antidotes where the antigen and antibodies reactions are present. Antigen and antibodies reactions are present. All right. So top example with us serological antidote are anti-snake venom, anti-spider venom, and PEP therapy for digitalis. Do remember there's an immunotherapy and antidote antibody reactions must be there. So now we discuss the last one is the physiological or pharmacological antidote. It's a very interesting one. It works on the antagonism mechanism. It's less like a seesaw. If one of the weight of the poison got increased, its effect will be increasing. At the one time, we are giving the two poisons to counteract the effect of each other. We're gonna give them until unless the seesaw is balanced on the both sides. If one of these poisons got increase in the intensity, that it will got imbalance, and the intensity of the other poisons and signs and symptoms start appearing. This is actually the main basic behind this poisons. For counter effect the poison, we are giving another poison to lessen its effect. If the intensity of the other poison that we are giving as an antidote is higher, then it will affect higher than the previous sign and symptoms. So this is a very interesting phenomenon. They produce the pharmacological effects, or they are also known as dynamic antidotes. Top example हमारे पास क्या है? What is top example is the organophosphorus poisons. We give the atropine, so they will counter effect each other. But if the intensity and the dose of the atropine is higher, got higher, so the atropine will start its effects inside the body. We talked about that. It's act on the action principle of the antagonism, and the action is mostly partial. And this is very limitedly used because we are giving two antidotes and one time to control the effects. Now, the last topic is the universal antidote. Any antidote which is given when the poisons are in different mixtures and we don't know about that. So, we give four different components of antidotes, combine them together, and we name them as a single antidote. To remember, it has the four parts. The two parts contain the activated charcoal, highly adsorbent, and is a mechanical antidote, one part of the tannic acid, and one part of the magnesium oxide. All of them, when combined together, have a very high effect of an antidote. We call that universal antidote. So most of the time in OSCE and exams, question has been asked that what is universal antidote and what are different components of universal antidote. So universal antidote is the antidote that used universally for the combination of one or two or three mixtures of the poisons. It has the four parts. Two part contain the activated charcoal, one part tannic acid, and one part magnesium oxide. Thank you so much. That's today end of the today's lecture. Is there any question? Please do ask me.